I'm Dr. Fred Rodosta. I was a staff urologist at Opelousas General from July of 1971 until I retired at the end of December of 2020. And prior to that, I was a urologist on staff at the Public Health Hospital in New Orleans and associate professor at Tulane. I was fortunate to have been born at the right time, been in the right place, had the right experiences that allowed me to make a difference between, and that was the enjoyment, and that was the fulfillment.
Fred's just a good guy. He's committed to excel at whatever he's doing. He's a hard worker, easy to consult, to deliver excellent care to the patients. That work ethic carried over on his ranch. He was a very successful rancher, cowboy and roper, and great doctor. Good at all of the things that he did.
I first saw Dr. Rodosta, met him in 1972. I was about 18 years old, and I had to see him as a patient. And that was my first encounter. Fred's real. There's nothing fake about him. What you see is what you get. He's there. He's the same every day. Fred's the guy that you pick up the phone. You want him there. And then at the same time, you're going to have fun because he's going to make you laugh no matter how difficult the situation is.
You know, I was really honored to be asked to talk about Dr. Rodosta, but my only concern was that I wouldn't be able to do the man justice. I remember 20 years ago when I first came to St. Landry and I entered the operating room. I was standing there and all of a sudden I heard some yelling from down the hall. Around the corner came this cattleman, boots and all, rough looking. As soon as he walked in, everyone jumped into action. It was almost they had done this 1,000 times before, and in fact they had. That was 20 years ago and he had already been doing it for 30 years.
Dr. Rodosta, I'd have to say, probably the most unique individual I've ever met. They really broke the mold. One thing I could say, and I always admired about him, he always had the best attitude. It didn't matter what he was consulted for, good, bad, it was always positive. It was interesting with Fred, he was touchy-feely with the films. Well, here came the PACs. He had an aversion to computers, but he still liked to touch the images.
Dr. Rodosta and I first met when I first came 16 years ago, quite frequently referred to me as that little doctor, and didn't take it any offense to it, but he had a very paternalistic role here at the hospital. The longer I got to know Dr. Rodosta, the more I got to see his commitment.
His take on things is, and explanations of how it went down is just unique. It's hard for someone, just to take off with a story and make it interesting, let alone funny, of what he was thinking and putting you in the moment. He was really good at doing that, and you never get tired of those stories.
I would like to thank the Opelousas General Health System, the board, the administrators, the employees, and all the people that make it possible for me to have qualified for this Hall of Fame bestowed upon me.